I'm Dr. Michael Jacobs, the Medical Director of the Clinical Microbiology Laboratory at University Hospital's Case Medical Center in Cleveland, Ohio.
Hi, I'm Kathy Roman. I manage the microbiology labs here at University Hospital's Health Systems Case Medical Center campus. Our laboratory fast facts basically to describe what goes on in our system here at University Hospitals. We generate 4.1 million billable tests a year. Approximately 12.5 million actual tests are performed in our laboratories at the Case Medical Center campus of our system. We have 300 FTEs, 140 of whom perform actual testing, the rest doing support functions. We courier samples over 438,516 miles per year to bring our samples here to our centralized testing. We cover a full range of microbiology services, including bacteriology, mycology, mycobacteriology, parasitology, and virology. We do all of the work here for our system, which includes 5 community hospitals, soon to be 6, with a very large outreach business as well. I've been here at University Hospitals for about 5 years. I come from another multi-hospital system with the Consolidated Microbiology Lab. My premise is consolidation of microbiology labs is efficient, productive, and cost savings, with a lot of cost savings as well. But hence, to manage the volume of incoming samples where the work can be laborious, repetitive, and time-consuming in a world where we have very few medical technologists available.
We're a 900-bed academic medical center, and the microbiology lab now covers our academic medical center as well as 3 community hospitals. So we've been faced with many challenges over the last few years in coping with an increased workload, and we've needed to become as efficient as possible.
Managing this volume for us in a consolidated environment is a challenge, and when we first saw a videotape of the WASP, we were ecstatic. I was ecstatic. Having a second head of manager information systems, being very heavily involved in the laboratory information system and instrumentation throughout my career, this was a perfect fit for us to allow us to automate the tedious task, as other labs have had for many, many years, and free my staff to handle more complex testing. Immediately, it was a vision for me to say, stepwise, we can really make this work for us and be advantageous to the staff, to the facility, and as we have found out, moving down this path, to have a very large quality impact on our sample processing as well. Next step after deciding, like, absolutely we want to move forward with this kind of automation and having very strong and continued administrative support to move us forward with this kind of technology, kind of stay on the leading edge of things. We're proud to get the WASP on board. We've just come miles of moving through, starting with urine samples, different tube types. It has allowed us to make major quality initiatives for sample preservation. It has forced my hand to get uniform specimen containers throughout our very large system. We're happy with the system. We're pushing all of our urines of 300 and some a day through the WASP in 2 different container types. With most compliance, as we all know, it's not an easy task. We are manually streaking some urines, and we will always have to. But the brunt of our volume is being pushed through. The WASP reads our barcode label, essentially, any way that it's on the container. So if it's on vertical, sideways, horizontal, diagonal, the barcode labels are very readily read and reproduced by the WASP, which labels our plates for us. Moving forward to the e-swab, is our next step in the game, to automate all that tedious processing as much as we can, and to have a system where multiple tests can be done off of a sample already in fluid. That PCR orders that in the past would have to be canceled because we received sample on swab or the wrong type of swab will be eliminated. This is the end of my dream for bringing this thing on board, is to fully automate the samples that we can and move forward with having LIS interface. It's going to allow us to touch the sample 5 times less than what we do now. Our processors do over 100,000 keystrokes a day in entry. For us to improve on that process, automation with LIS integration clearly reduces that number, can reduce laboratory errors in sample labeling, in relabeling, and reduce the number of times that we have to touch a sample, clearly increasing efficiencies across the lab. LIS interface will allow us to not have to electronically touch the sample at all once it hits the micro lab. We're going to put the samples on the WASP. The interface will allow the WASP to tell our LIS that the sample is now in the micro lab and the sample has now been physically plated. From a quality initiative, our timestamps of, okay, urines go out 16 hours later after they're plated is a true 16 hours. We don't have to add it hours of windows or play a guessing game of really what time was the sample plated electronically, and we don't have to touch the samples 4 times to get it there once it reaches the micro lab. The technologist will simply rack, load samples onto the WASP, and plates will come off and get stacked in the incubator. In summary, I would say our strategy here at University Hospitals Health System has always been to improve patient outcomes. In order to do that, we've sought out new technology and innovations to allow us to better handle our patient samples here in the laboratories, to improve patient services in a timely fashion with quality and patient safety always being in our forefront. My experience with the WASP is that it's doing all of this for us. I mean, limiting the number of hands-on times we have to touch a patient sample, the fact that we will not have to relabel our samples that are going directly on this automation, and it's going to come off the analyzer prepared to move to the next step where the patient demographic and identification information is all included in a barcode on our samples so that there is no chance of errors, as well as allowing efficiencies where staff that is a limited resource currently can be used in their best capacity to do more complex testing and avoid tedious hands-on.